I think
Thank you.
now, because Dr. Charmila is not here, we have Dr. Venkatesh.
Hello everybody. On behalf of Manipal Hospital, I'll be speaking about the levels of NICU care and the NICU setup. I'm Dr. Abhishek. So, what are the essential components when we try to set up an NICU? So, we need a proper infrastructure, hand washing area, the infant space, then the power outlets, the isolation room, general space, space for working personnel, family space, lighting, noise levels, and the floor maintenance. So it has to be driven by a systematically developed program and which is ultimately required for the delivery of services to the neonate. So I just took pictures from Manipal Hospital, Old Airport Road. So where I'm working right now. So this is like an entry area. What should it should look like, and these are the certain guidelines that why it is essential for mothers to take care of the baby and the benefits out of it. So this is our transition nursery room. And this is the in view of the transition nursery, how it looks about. So this is the point of entry into the NICU, and this is the washroom. This is once we have entered into the NICU, the what is should be the equipment area, and this area can also be used for fumigation. And so the design should be such like it is flexible and it is also creative. And the NICU should be configured in such a way that there are services delivered to each infant and the family of the infant. And the NICU shall be located within the space which is designed for that purpose. It should be on the same floors as on the floor, the maternity services are available, and there should be effective circulation of staff, family, and equipment. And there should be a hand washing sinks which should be large enough, as I showed you in the diagram after the entry point into the NICU, which should control splashing and designed to avoid standing or retained water. So the minimum dimensions are 24 by 16 by 10. So I will will quickly go through my slides. As it is a very long topic and the time given is very short. So the hand washing system shall have both types of water, that is hot and cold. And it should be engineered so that a effective ventilation system is in place. And there should be space which will be provided for the soap and the towel dispensers. This is an ideal hand washing area. So it should be provided within each infant room, and if it's a multiple bedroom, then every infant bed shall be within at least 6 meters of a hand-free hand washing station. So this is our hand washing area. So these are the 6 steps of hand hygiene as given by the World Health Organization. So what should be the infant space in an NICU? So it should be minimum of around 120 feet square, that is 11.2 meters square of clear floor space. So this is our NICU. You can see the diagram which is depicting there is a warmer and the baby is there with the ventilator, and the power outlets I have shown. And this should be the spacing between the two neonates. This is the configuration in the NICU. And when there are single infant rooms, so there should be an adjacent aisle. An aisle is a passage between two seats. So not less than 8 feet, that is 2.4 meters. And if there are multiple bedrooms, around the area should be around 8 feet again. And there should be power outlets around each infant bed, such as electrical and gas outlets, and there should be total a minimum of 20 number of these outlets. So what we require is a combination of air and oxygen and also vacuum, which will be used in cases of suction. So this is as per the National Fire Protection Association recommendations. So the equipments what we require is neonatal resuscitation kits in the NICU, ventilators which will include the high frequency ventilators, radiant warmers, incubators, high flow nasal cannula, CPAP, both the ventilator and bubble, infusion pumps, weighing machines, portable ultrasound machines. PIC line is peripheral inserted central catheter lines, central line catheters, arterial blood gas analyzers, point of care analyzers, phototherapy units, transport incubators, and lastly the inhaled nitric oxide cylinders. So there should be an isolation room in which we segregate the infected babies from the non-infected ones. So this is our isolation room. And it should have a negative air pressure with 100% air exhaust. And the airborne infection isolation room shall have observation windows, and it should have a permanently installed visual mechanisms to constantly monitor the pressure status of the room. And there should be an identified entrance in the reception area before the family enters into the neonatal ICU. So this is about the general space for all the soiled utility items. This is our NICU protocols for different things. This is the area that where each and every document is kept. Along with the picture, you can see there's a portable ultrasound machine on it. So this is the room where we usually prepare the formula milk. And the waste disposal area, of course. So this area should be at least 1 feet square per bed and located outside the patient care area. So this is the color coding system for biomedical waste management, which is followed in most of the hospitals. So these are the bins which are different colors. And so there should be an additional separate area where we have things such as records or telephone communications are there. And there should be space for working personnel. So this is our doctor's room, which is just near the entry point of the NICU. And there should be also family infant rooms shall be provided within the area which is immediately adjacent to the NICU. So the lighting, coming to the lighting, the intensity, the illumination should not be more than 600 lux, that is 1 to 60-foot candles. And they should be adequately, the lighting should be adequate. And the luminaire should be capable of providing no less than 2000 lux at the plane of the infant bed. And coming to the noise levels. So the noise level should not exceed 45 decibel in a neonatal ICU. So this is the telephone area. So you can see the telephones which are away from the neonates beds. So floor maintenance is actually, the floor should be made of such a material which has a reflectance of no greater than 40%. And the temperature in the NICU should be around 22 to 26 degrees Celsius with a relative humidity of 30 to 60%. And there should be a minimum of 6 air changes per hour, which is required. And there should be a security system also, usually at the entry of the NICU. And there is a code pink, which goes with infant abduction. So if any code pink is announced in the hospital, that means an infant might have been abducted. So this is an overview of an NICU. You can see the beds, the distance between the two neonates. So now talking about the levels of NICU care. So as per the British guidelines, currently there are 4 levels of NICU care. Previously it was 1, 2, 3A and 3B. So, what are the objectives of an NICU level? So we need to know that there has to be a segregation, and because of cost and personal issues, and there is an education program which is there in the higher levels of NICU. the presence of a multidisciplinary team, and of course the accreditation guidelines. So this is level 1, 2, 3, and 4. So level 1 is called as well newborn. Level 2 is special care nursery. Level 3 is NICU, and level 4 is regional NICU. So the regional NICU will cater to all the complex surgeries, including the ECMO, that is extracorporeal membrane oxygenation. So level 1, what are the so what do we want from level 1 care nurseries? So what should be the capability of these? So provide the neonatal resuscitation at every delivery, evaluate and provide postnatal care to stable preterm infants, and stabilize infants born between 35 and 37 weeks gestation who are stable. So who are the providers in level 1? Pediatricians, family physicians, and practitioners. So what is level 2? So all which I have mentioned in the previous slides, the level 1. So level 2 is basically level 1 plus more than the infants whose gestation is more than 32 weeks and the weight is more than 1.5 kilo, and who have physiological immaturity and who can go into apnea and have feed tolerance issues, and who require assisted ventilation for less than 24 hours or a CPAP, and provide mechanical ventilation for brief duration, that is less than 24 hours. And the purpose is to stabilize all those infants born before 32 weeks, and the weight should be less than 1.5 kilo. So who are the providers in level 2 is level 1 healthcare providers plus the neonatologist and the neonatal nurse practitioners. Basically the neonatal nurse practitioners are those nurses who have expertise in the basic neonatal care, especially including the preterm infants. So what is level 3 care? So level 3 care, so what should be the role of healthcare providers in level 3? So level 3 is provide sustained life support and comprehensive care for less than 32 weeks and less than 1.5 kilo, and which includes the high frequency ventilation and the use of inhaled nitric oxide. So providers are level 2 plus pediatric medical subspecialists, pediatric anesthesiologists, surgeons, and ophthalmologists. So lastly, I will come to the level 4 care. So level 4 care is, it's like a regional NICU located in an institution who are able to provide comprehensive, complex congenital surgical conditions which are, or which can be acquired also. And there is immediate on-site access to pediatric medical surgical specialties and pediatric anesthesiologists, and who can facilitate transport from a level 2 or a level 3 care hospital. And these institutes are normally, they are normally into DNB teaching and for research education. So providers are level 3 care plus pediatric surgical specialties, including the various systems. Thank you.